Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, true cut biopsy. We have true cut biopsy or also called as core cut biopsy. In true cut biopsy or core cut biopsy, this will provide actually a histological specimen, and thus it provides a histological specimen which is interpreted by a pathologist, by any pathologist. In fact, any pathologist can interpret a biopsy specimen results, and this true cut biopsy can tell us about the ER status, it can tell us about the ER-PR status, and also presence of HER2 new overexpression can also be done in the true cut biopsy. This can be routinely determined. Then we have diagnostic technique of choice. This is the diagnostic technique of choice in many conditions. Especially it is diagnostic technique of choice if we have to do preoperative systemic therapy. For preoperative systemic therapy, in order to give preoperative systemic therapy, we should do true cut or core cut biopsy. So this true cut or core cut biopsy is also rapid. It is also relatively painless. Then it is inexpensive, and here no incision is required. Then false negative results can also occur in this also. And one more important thing is incomplete lesion characterization can occur in the presence of this true cut biopsy. It is incomplete lesion characterization can occur. So these are the main disadvantages. Main disadvantages are presence of false negative results and incomplete lesion characterization.
thank you and thank you for watching.